In this segment, we will demonstrate how to self-suction. Now we recognize that this may be an emotionally difficult task to self-perform. Some of you may even wonder why suctioning is important. The epithelial lining of the trachea produces secretions we commonly refer to as mucus. Normal habits like walking, talking, and even coughing are able to help loosen these secretions, making them relatively easy to get rid of. Now in the event of a trauma, as with the insertion of a tracheostomy, inflammation naturally occurs and the lower lobes of the lung begin producing phlegm, a form of mucus, to protect the epithelial lining from bacteria or foreign substances. These secretions can build up and create a mucus plug, which, as the name implies, is dried mucus that may block the airway. This is why we use humidified oxygen with tracheostomies, as this allows us to protect the epithelial lining and keep secretions moist.
Remember, even if you will be discharged with home health or are going to a skilled nursing facility, the health of your tracheostomy is the health of your airway. It's therefore in your best interest for you and your loved ones to practice proper technique for suctioning in case of an emergency. As long as you demonstrate a willingness to learn, your nurses will help guide you to ensure proper technique.
Begin by gathering your supplies. These include a suction catheter kit, portable suction, and a normal saline solution. You'll want to wash your hands thoroughly, as this is the best way to prevent infection. During hospitalization, your nurse will utilize sterile technique, but clean technique may be used in the home setting. Take a moment to put on your gloves. Next, place your thumb over the control valve. Practice applying intermittent suction by tapping the control valve with your thumb. Note that the catheter will only suction when the thumb is over the control valve. Using your dominant hand, roughly eyeball 6 to 8 inches, and then proceed to insert into the inner cannula. If resistance is felt, pull out a few centimeters and then advance the catheter again. After the catheter is advanced or you begin to cough, slowly pull out the catheter while gently rotating your fingertips while applying intermittent suction. It is important to only suction when pulling out the catheter. This should be intermittent and should last no more than 10 seconds. Allow yourself a short break and repeat. If the catheter is filled with secretions, use saline poured into the cardboard container to clean and moisten your catheter. Although we do not reuse the catheter in the hospital setting, please take the opportunity to practice your intermittent suction technique with the used catheter. Have your loved ones practice as well. Remember, you are not expected to do this on your own while in the hospital. Your nurse will be here to assist you and your loved ones in performing proper technique.